Hello, welcome to episode 99 of Your Ultimate Comeback. We're one away from 100.
I love that.
Pretty awesome.
I know.
Yeah.
I know.
Well, I'm excited for 99. I mean, 100 is going to be great.
Yes.
But a couple weeks ago, I shared with you about, I had an experience called EBO2. It was a treatment of Dr. John Laura's. And today we have Maya Christine, nurse practitioner specializing in longevity. Here's our guest.
Yay.
And she's going to talk to us all about EBO2 and what this was.
And how about what that stands for to start with?
That's probably a good thing because I couldn't remember.
Yeah. Thanks for having me, guys. We're super excited to be here.
Yeah.
So EBO2, it's actually been around for a very long time. Countries like Asia, Europe, South America, it's like very popular there. It's just now kind of gaining traction here. So EBO2, basically it stands for, this is going to be a mouthful.
Okay.
Extracorporeal blood oxygenation and ozonation.
Wow.
That's why I could not remember it.
Okay. Wow.
It's a lot.
That is a lot.
So basically what that means is we're pulling a little bit of blood from you. We're filtering it out. We're oxygenating it, and then we're flooding it with ozone. And then we're putting it into this light device, which does a few different things, depending on the color of light and wavelength. And then we're putting it back into you.
Wow.
Yeah.
And Brad's was frothy. I saw the picture.
Yeah.
Let's just jump right to the bad stuff.
Sorry. It was frothy. I saw it.
No.
We got to put that picture up, Caesar.
Oh, yeah. We'll share the picture of what they filtered out of my blood.
Yeah, you got to get the picture of the two different colors, too.
Oh, yeah.
When your blood's getting pulled
we
out.
didn't even clip in the video of actually you running,
great idea.
doing the treatment on me.
Great
so
idea.
you kind of see
Yeah.
the whole process. Well, you just explained what that actually looks like.
Right. It's super neat.
Yeah. It was
super neat, she says. Some people can't even look at blood or needles or anything, and she's like, it's super neat.
Yeah.
I love it.
Yeah.
Well, you probably love also knowing that you're changing things for the better.
Yeah.
Right?
Oh, yeah. No, it's really cool, like, seeing the difference, especially if someone's doing it consistently, which is what's recommended.
Right. Which is how often?
So
Perfect
usually I recommend 4 to 6 sessions within a span of a few weeks.
Wow.
Yeah. So, and then after that for maintenance, I always like to say seasonally, just so you can it's easy to remember. So four times a year.
Okay.
Yeah. For maintenance.
Interesting. I didn't realize it was that many up front.
So you're behind.
Yeah.
You got about three more to go.
I'm still enjoying the benefits of round one.
He said he slept so well.
I still, every day since, what was that, a couple weeks ago now?
No. God, men in time. It's the football time. I say this every time.
That's
football
right.
time. 15 minutes left, in the court. No, 15 minutes takes 45 minutes with y'all. It does.
That's so true.
Right? Right?
There's only 2 minutes left in the game.
Yeah. Which is 20 minutes later. So that's what he's like, just 2 weeks ago. No, he doesn't even know.
Oh, so it was like 3 weeks ago, maybe a month. I don't know.
Yeah.
But from that night on, I have slept through the night, all night, without an issue.
That's
and
amazing.
prior to that, it was never. I would wake up a couple times a night.
That's awesome.
Like that to me, right there, was worth
it.
Yeah.
the whole thing. I mean, I have not slept this well in a long time.
That's awesome. And you told me you had like some lucid dreams too, right?
Oh yeah, like crazy dreams, especially like the first week.
Is that right?
Like super vivid dreams.
That's awesome.
Can you share with our audience?
I cannot. Inappropriate.
Damn it.
You share those kind of stories. I do.
Oh, come on.
It's funny because there has been, a lot of my patients do report that they either slept really well or they have been lucid dreaming. And they're like, why is that? And it's interesting because there's no clear studies that show that there's some sort of link. But, you can theorize that if you have a decrease in inflammation, right, in your body, and you're flooded with oxygen, then obviously you're going to have less brain fog. So your mind's going to be more clear. So that's my theory as to why people do lucid dream after an EBO2.
It was, especially the first week was super wild.
Yeah.
I still have them, but not every night. Like the first week, it was every night, this crazy deep sleep.
And you would remember.
Wild dream. And I could remember the dreams. Like wake up like, was that real?
Yeah.
It was pretty crazy. But since then, like every once in a while, I'll still have them.
Was it like Selma Hayek was in your dream or something like that?
That would be a good one.
Yeah, that used to be one of my husband's favorites.
Oh my God.
Her and
husband has good taste.
Penelope Cruz too was the other one.
Oh yeah, she's cute.
Yeah.
Yeah. But yeah, I've been kind of like waiting for the night to where I don't, I wake up like.
You're still waiting for the night because I love it so much.
Can't wait to go to sleep. No, just waiting for the night, like where I actually wake up during the night. It's been pretty wild to me. That's been so consistent.
Well, maybe it's not going to go back.
Maybe
for a minute.
Yeah, I mean, I'm okay with it.
Yeah,
I'm not complaining.
Yeah,
but
that's awesome.
Yeah, that was I wasn't. So I went into this. Dr. John told me about it.
Mm-hmm.
I'm like, oh my gosh, I want to do that. He's like, oh great, we're gonna get it done. I'm like, I purposely didn't look into it at all.
Okay.
At all?
At all. I just wanted to go experience. I'd heard about it years ago. I remember hearing about it years ago. I'm like, oh, that's really cool. And then he told me you were doing it. I'm like, oh, I got to come do it. But I purposely didn't look into it because I didn't want any expectation. I just wanted to go into it kind of blindly and then be able to like, okay, well, here's the differences that I feel since I've gone. Why?
Yeah.
And so I thought this would be a perfect time to kind of go through all that.
Yeah.
So obviously the sleep has been incredible. My energy's been phenomenal in regards to like I'm needing a lot less caffeine. My afternoon, like usually I'd like would have to come home, take a nap before football practice. That's all gone. My energy at my son's football practice from 6 to 8 every night is just off the charts. Like playful, fun, happy to be there. What is it? I mean, I think it's kind of obvious why energy would be so much better. We'll get all that crap out of there, but
and why was his foamy? We need to.
Oh, I'll
get to that next.
Too. Okay. And almost all the time, everyone's is foamy.
Is that right? Okay,
yeah,
you're not.
So as far as the energy goes, the ozone actually helps produce like endogenous NAD. It helps create NAD in your body, which of course it contributes to your ATP production, which everyone knows, which happens in the mitochondria, right? At the cellular level. So it actually increases your energy. So I think that's why. Also, just with the decrease in inflammation, another thing that ozone does is it activates what's called the reactive oxygen species. ROS for short. But what that does is it triggers something called the NRF2 pathway. Now, the NRF2 pathway plays a really important role with decreasing inflammation in your body. So as far as the energy goes, the ROS triggers that NRF2 pathway, and that pathway plays a really important role in decreasing inflammation all throughout your body. And I think that coupled with the, exciting your NAD production, I think those both go hand in hand when it comes to, creating more energy in your body. So I think that's why people feel like they're performing better, especially athletes. They're, obviously when you're detoxing, when you're getting all the sludge out of your blood, you're just feeling more clean and you just feel more
changing your
productive.
Oil. Changing your oil.
Changing your oil, yeah. I think Gary Brecka said that.
Oh, really?
I think that's how it, Gary
Brecka. That's what it sounds
in like a video, he was like getting EBO2 and he's like, oh yeah, guys, I'm changing my oil here. And I'm like, that's so clever.
Yeah,
like,
that's what it feels like.
Yeah, it's a cool way to like explain it.
Now, I'm wondering like, who discovered this? Who thought, hey, this sounds like a great idea. Let's try this.
Honestly,
you said it's been around for a long time.
Yes.
It
was a doctor.
Okay.
I don't know his name or much about.
Yeah. But how long have you been doing this treatment at Dr. John's?
We've actually just started a few months ago.
Oh, okay.
Yeah. Dr. John Laura actually had this EBO2 protocol years ago before, anyone even knew about it.
Okay.
He's like way ahead of its time. Yeah. I mean, he's amazing. And he does a lot of research, and puts forth a lot of, things into his practice. But I just don't think there was like staff and enough trained staff to like actually do it. So when I came along, I'm all about wellness. I'm all about like just finding different ways to just optimize your health, right? So we just got to talking and he told me he had it and I was like, oh my God, like let's bring it back. Like I'll do it. Let's, so
awesome.
So we just kind of brought it back. Yeah.
That's so cool. And how is it being are a lot of people jumping on board?
Yeah. A lot of people that have, chronic issues. So a lot of autoimmune disorders actually benefit. So if you have like Epstein-Barr, if you've got lupus, even people that suffer from like long haul COVID benefit a lot out of EBO2.
Yeah. So explain to us how it's done. I mean, Brad was just like, I'm stuck
Yeah.
I said, can you read? He's like, no, my arms. Yeah. So you just chill.
So you're just chilling for about 45 to 60 minutes.
Okay.
Once it's a closed system and I start the pulling of your blood, that at that point it's about 45 to 60 minutes. So what you do is you come in, I gain 2 IV lines, so access on both arms. So one's going to be pulling blood out. The other one is going to be reinfusing blood back in. And that's really the only time where you feel discomfort is just the poking, right? I mean,
it's like
you mean just like a blood draw poke, or is it a little more than that? It feels a little more like.
It reminded me when I donate blood.
Yeah.
So it feels like that's what it reminded me of. So it's just like the poke you get when you donate blood.
Yeah.
And it's not bad.
Yeah. Cause it is a needle, you know.
Sure.
So you're guiding the needle in, to put the catheter in. And then once that's done, you start getting your blood pulled. And it's about, I want to say around 250 milliliters of blood outside of your body, at a given time.
Okay.
Is
that a lot? I don't know.
It's not much, no.
Okay.
Obviously, we want to do it
If the zombie
safely.
apocalypse came at that moment and he needed to unplug immediately, would he die? Would he?
Yeah, he'll be fine.
Okay.
He'll be fine.
I'm just curious.
That's a great question.
Thank
That's
you.
a great question.
Thank you.
That's a great question.
It was.
You want to know something funny?
What?
So I had all these questions that I laid out and I sent them over to Maya just so in case you were prepared. You're asking all of them.
About the zombie
great.
apocalypse.
Oh, I did not know. There was no zombie apocalypse. But up to that point, I'm like, that one's off. That one's off. That one's off.
Yeah, I'm just good like that, Brad.
I love it. So once the blood starts getting pulled out, it goes through a filter. It's a medical grade filter. It's actually a dialysis filter.
Oh, wow.
But people get it confused. So we're not doing dialysis because dialysis is we're pulling out excess fluid. We're pulling out electrolytes like potassium. We're pulling out things that, the patient doesn't need, but the kidneys can't excrete out, right? Because that's people with dialysis, right? Because when your kidneys stops functioning, that's when you need a machine to do it.
Right.
But with EBO2, even though it's the same filter, what we do is we turn it upside down. And what that does is it actually catches all of your good stuff that we want in you. So your white blood cells, your plasma, your nutrients, things like that. We're keeping that in. We're not losing it. So that's really the difference.
Wow.
People are asking about the filter because I knew it was a kidney dialysis filter, but you flipped it upside down. I could not remember why.
Yes. And that's why, because we want to keep all that, right? So it goes through that filter. And then once it goes through that filter, it enters the ozone machine. So that's where you're getting flooded with oxygen. You're getting flooded with ozone. And the cool thing about ozone is if given in safe doses, which is what it does, it actually produces something called nitric oxide. And nitric oxide is cardioprotective in nature. So it actually is really good for your heart health. So it vasodilates your blood vessels. So it's really good for like hypertension, people with high blood pressure. It actually
mine
protects.
did come down a little bit.
Did it? Yeah.
Yeah,
It protects against, any risk of you having stroke, and heart attacks, things like that. So it's ozonated. And then once it's ozonated, the last step that it goes through before it re-enters your body is it goes through what's called a photobiomodulator. So that's the light therapy.
All these big words.
But I'll explain.
Yeah.
So that's a light device. So the light, it comes in, green light, red light, purple light, UVA, UVC, and they all do different things.
Okay.
So the red, helps with inflammation. The green has antimicrobial properties. The blue has antimicrobial properties. The green has antiviral, antifungal.
Wow.
So even if you're like sick and you feel your vitals are stable, you can go get it, and it can kind of clean out all those viral toxins. Yeah.
So here's a stupid question, or maybe not. No such
question is
thing.
stupid.
That's right. Teacher, did you have a teacher that said that? I definitely did.
Yeah.
So I'm envisioning his arms are out. Yep. One's pulling, what's whipping through these machines, these filters, and then is it literally like a big circle?
Yeah, pretty much.
So
right?
it's coming out and going pretty much directly back in. Okay,
yep.
so
But I like it. They cross the line so you can see the change in color.
Yeah.
Okay, so tell us about that. Cool. What color were you when
it's just
coming out?
The blood coming out, it just looks darker, and the blood going back in is like a much brighter red.
Yeah. like a crimson red. Yeah.
It's very drastically different.
You could see it. Yeah. You could see like
So that's right in front of you.
Yeah. It's like laying there, just right there. You can. It's pretty cool.
And tell us about the sludgy stuff. I'm so fascinated by that.
Yeah. So it's super cool to just see it. So the sludge, right, that comes out is really your lipids. So your fats that get stuck in, your inflammatory particles. So that frothy like substance that you were talking about. So that's actually inflation.
This is the perfect time to put the picture of what they extract.
Yeah.
So all that froth that
like
sits
a
on
beer,
top of the fluid is inflammatory proteins.
And everybody has that, I'm sure.
Everybody, almost everyone.
Have you ever seen a really crazy amount?
I have actually.
And
Yeah. That's when I'm like, all right, let's switch up your lifestyle and diet and exercise.
I'm glad we didn't have a conversation.
Yours wasn't too bad. No. But
that's just wild, though, when you think that there is a visual image that shows you you're going down the wrong path.
Well, I was amazed how much stuff it filtered out.
Oh, yeah.
Does it get less the more you go?
Yeah, it should.
Okay.
Yeah. Yes. In theory. Yeah. As long as you're like doing things right, you have healthy habits,
It
and you're not
how many 7-Eleven stops you make. Yeah.
Yeah.
But
so
I don't know what you're talking about.
No. So the whole treatment, like an hour?
Yeah,
from start to finish.
So from start to finish, and when I say start to finish, like once I'm starting to pull blood, and you're sitting there, around 45 to 60 minutes.
Okay.
Yeah, and in those 45 to 60 minutes, I'm, checking your blood sugar, making sure you're not dropping. I'm checking your blood pressure. I'm checking your O2 stats. I'm checking all the things, just making sure you feel okay.
Right.
But the patient, they don't really feel much.
Right.
They're just kind of sitting there.
Yeah, true.
Yeah.
Super true, yeah.
Yeah. Some people take naps.
Really?
I mean, you can just...
Can you watch a movie or anything?
You can, yeah.
Okay.
Mm-hmm.
Okay.
She's wicked smart, so I was just asking her questions the whole time on all these different topics.
I would. What if you
That's usually what I do. I just hang out with them
That's
the whole
awesome.
time. But
if someone feels lightheaded, what do you do?
So
you feed them peeled grapes with a palm frond. No, I don't know.
Yeah, so there's several things that can happen. It just really depends on each person. Because when you're detoxing, you may get a reaction because your body just may not tolerate it, especially if it's your first time. Sometimes it's due to the ozone. Sometimes it's just due to low blood sugar. So I usually, I'll pause it. I'll check blood pressure. I'll check your, blood sugar. Yeah. Almost all the time, it is your blood sugar. That's when you get the lightheaded, you get shaky, you get sweaty. So it depends on how much you drop. So if you drop 10 points, I'll give you some orange juice. I'll give you a protein bar. You feel better instantly.
Okay.
If it drops more, I'll give you some dextrose through your IV. Instantly feel better. And then we,
Do you tell people to eat or not eat?
I was going to say they were very pointed on what to eat.
Absolutely.
And what to eat. What to eat.
Yeah.
Yes.
I got like multiple messages ahead of coming in to make sure
what
that
are you supposed to have? Not your McDonald's.
just a larger meal of carbohydrates before you go in.
High carb meal.
Yeah.
High carb meal.
Yeah.
Okay.
They were really
Because-
persistent on that.
Yeah.
Okay.
And the reason being is, one of the main things that can happen is your blood sugar dropping. So when you're eating a high carb meal, obviously your body processes carbs into glucose. So we're making sure your blood sugar is high before you do it.
Okay.
Yeah.
All right.
So.
Do you have people that are resistant to that ever?
Little bit. Sometimes I get pushed back and I'm like, just do it. Just this
I
once.
could see this. See?
Yeah.
I could really see someone's be that
Because right
way.
now it's like low carb, high protein.
I know.
Yeah.
And do you ever get anybody that's like, I can't look at the needles. Oh my God, blah, blah, blah.
Yeah, I do.
And then what do you do? Blindfold them?
So actually, yes.
Really? Oh my goodness.
So we have eye masks, just, and we give them
Chill music.
Just, meditative music.
Nice.
We can put blankets over you so you don't have to see it. We cover it. And then we can like kind of put the machines
Therapy
like
dog.
a little, absolutely.
Really?
Yeah. Oh yeah.
You have
As long as they're
they can bring their therapy
as long as
dog.
they're like
chill.
Mine would not be chill.
No.
So yeah, I mean, there's so many things we could do,
Oh, that's fascinating. I wish I could have seen it when you did it.
I had the video clip.
Okay, good. We're going to put that. Yeah, I can't wait to see
I
that.
posted it on Instagram, and a lot of people were like, "What is that? What are you doing?" That's why I was super excited to do this podcast.
Well, you should do it. Why not?
Kind of scared.
Yeah.
You know what, though? Honestly, there's so many rad things that am I aging myself by saying rad? Yes,
Not
I
at all.
am. The kids say, there's so many sick things. No, there's so many cool things.
That's still outdated. That's still outdated.
Is sick outdated? Okay, what's the hippest
I know.
one?
What's the
What do you say?
word now?
What's your son saying?
I should know this.
6, 7, beyond that crap.
So, in regards to 6, 7,
Yeah, well,
I rolled into practice this week with my sweatshirt on, and I took it off to my 6, 7 jersey.
Oh my God.
no.
So funny.
Oh my God. I love that. I
don't even know what that means, by the way. I just see it on like
to do with a song,
Instagram.
and the kids are like all about it.
Yeah.
Yeah. So funny. But what I was going to say is that there's so many unique and cool things that Dr. John's office does. It's like,
It's awesome.
I need to have all the time in the world and all the money in the world to be able to just go check these things off. Because
Go hang out.
really,
Yeah.
because there was a lot of things as I was speaking with Elle the last time, I'm like, wow, I want to do that. I want to do that. I want to do
Yeah.
and there's so many things for the longevity and wellness space.
Yeah.
That's what's so cool.
Yeah. I feel like we're like a one-stop shop for
You
everything.
really are.
Which
You
is really
are.
cool.
Mhm.
Yeah.
Have you worked at a place like that before where there's so many different?
Not like this.
Yeah.
No. Yeah. Dr. Laura's special for sure.
Yes.
Yeah. So. Yeah, I love being there because it's just fun. Like it's just so fun.
I hear that from his staff that everybody gets along. That's so great.
Yeah, the culture is great, and the patients see that too. Like patients will come in and be like, "I want to hang out here. Like my appointment's done, but like let's hang out."
Right, I'm sure.
Because we're all just laughing. And
I'm trying to get Elle and Jessie, and I'm blanking on the other girl's name at the front desk.
Lauren.
Kind of reddish hair, or let's call it strawberry blonde.
Kristen?
Oh my God, I don't know. Well, anyway, they wanted to come to one of my classes, and we were talking about it. And I don't know if I should say this on air, but it was funny.
What do you...
I teach hot yoga. I teach.
Oh my God, that's amazing!
I teach yoga lattes and sculpt
cool.
and regular vinyasa style at Raw Yoga Studios.
Oh, awesome!
Yeah. So they were talking about all coming together, and Jessie says to Elle, "I'll come when you come." And we were dying. So it was just, I know. That's why I said, Caesar going to have to bleep that. It was funny. It was very funny. We were all laughing and had a moment. But
we've got some fun personalities.
Yeah, that's what I mean. And you know what's cool about that is that it makes someone feel comfortable, I think. Because the stuff you're doing it
can be scary.
Yes.
Yeah. I think building that rapport with all of our patients is so important.
Absolutely.
It's like family. Like you walk in your family, you know?
No, I agree.
Yeah.
Well, I could tell like there was a lot of like, because I obviously, never had done before.
Sure.
A lot of conversation, like, trying to distract me a little bit.
Yeah.
Point.
Do you have your shirt off when you do this?
No, it's just like this.
Yeah. Well, I'm surprised I didn't ask you.
As long as like we have,
I was just
visibility.
teasing.
You're on one today.
I just flew right over.
I really am. I don't know why. It's episode 99. That's why.
Oh, is that as well?
Yeah.
I love it.
I don't know.
Is there anybody that shouldn't do EBO2?
Really good question.
That's a great question. So yes. So if you're pregnant or breastfeeding, I don't advise.
Check, Brad.
If you have a history of anemia, so, low blood count, there's obviously the risk of, fainting, things like that.
Yeah.
But if they're stable, obviously, we do our due diligence. I look at labs prior. We do a whole, consult beforehand, and I make sure you're good to go. But yeah, so anemia would be one. If someone has at baseline chronic low blood pressure, I take a look at that.
Yeah.
And then there's also, if you are actively undergoing chemo with cancer, there's the risk of the chemo actually being filtered out.
Oh,
the EBO2.
Wow.
Yeah. So I think that's mainly the few contraindications.
Okay.
Yeah. Mm-hmm.
But really good for people with autoimmune.
Really great for autoimmune, really great for chronic infections, and really just a healthy person that just wants to like feel their best.
Yeah.
So yeah.
How quickly did you notice it?
That night, because my son had football practice that night.
So it was. What time did you finish?
I don't remember. It was midday, I think.
Oh,
yeah.
I think it was midday.
So a couple hours later, you started to feel some
football
benefits.
practice at 6:00. What I noticed at football practice was like cardiovascularly, I wasn't getting as winded because I'm out there, I'm running around and I'm yelling and I'm talking, and I'm like, oh my God, I'm out of breath. And I didn't have it that night. It was really cool. So
you felt like the Hulk.
not quite the Hulk, but
Yeah.
I felt like I could like actually go run some distance.
Maybe after a few more, you'll feel like the
The Hulk. You're gonna be my muscle back.
Yeah, I love it. So who primarily do you see? Men or women mostly? Or half and half? Really?
Both.
Okay.
Yeah, both.
So no.
There's no, I would say it's equal.
Wow.
Yeah. Mm-hmm.
Okay.
Yeah.
Yeah, the interest in my post was
Was it
equal.
a mix? Yeah.
Yeah, it was very 50-50.
Yeah.
I didn't have anybody be like, why would you do that? Everyone was like, what is
Well,
that?
think about your clientele, though.
Well, yeah. I'm
you know.
talking, this is on Instagram, though. A lot of people I
okay.
don't know.
Okay.
Yeah. My clients are all super intrigued by it.
I bet.
Yeah.
I bet you're going to get a couple of your clients going there.
Trying.
I know.
They're on the fence.
Really?
So I'm hoping this pushes them towards it.
Yeah.
A lot of it was, I want to see how you feel. I want to see what your response is and that kind of stuff. I was kind of the test dummy.
I wouldn't think there would be anything bad. To me, it seems like there could only be benefit from this.
Yeah.
I couldn't, I mean, I had no negative side effects or anything. It was all very positive.
Really the only like negative, quote unquote, would probably be just either that day and like I said before, you know, it really just depends on how your body tolerates detoxing, right? So, you know, they might feel a little like tired. They might want to take a nap after, or they might just feel super energized. So we just won't know until the first one.
So you wouldn't tell someone if you have a big event that night, do it before, or if you have a big event the next day,
I would do it prior.
I see.
Yeah, the day prior.
That
Yeah,
makes sense.
because usually the day after you're feeling great, you know. So
Yeah. I after doing it, I had a couple of my athletes reach out saying that that's kind of a big thing in the world of athletes now.
Oh, yeah.
That they'll do EBO2 a couple days before big performances. What is the benefit to that?
well, I mean, honestly, when it comes down to it, it's the lowering of the inflammation. And when you have a ton of oxygen circulating your body, you're going to perform your best, you know? So, but also just like quick thinking, right? On the field, that attributes to the mental clarity that you get.
Yeah.
Yeah.
Okay, cool.
So, yeah.
Have you done it yourself?
I have.
You have?
Mhm.
Okay.
Yeah.
And how did you feel?
Amazing.
Really?
I felt, and I'm actually someone who has chronically low blood pressure.
Oh.
And it was actually my trainer when I was getting trained to do this. She was like, do you want to do it? But she was like a little hesitant because she's like, I don't know, you're going to be my problem child. You're very low blood pressure.
But that's probably good for you to have done that because you know.
Yeah. But I was fine. Yeah. I felt really great. I had great sleep. I felt energized. I just felt more like clear. Yeah. Like my thought processes were just clear. And I was just focused. It was great. And I felt more light, if that makes sense.
Yeah.
Prior to doing it, I kept explaining to people like my blood feels sludgy, like it just doesn't. Especially cardiovascularly, like I was like running around and stuff. Like God, I just feel like I'm having to work harder to push my blood around, and that feeling has completely alleviated.
That's awesome.
That's what I like the whole oil change thing because that's what it felt like. If I just got all the sludge out, and my blood can just move normal now.
Yeah,
that's awesome.
Yeah. Dang, I think we've gone over all the questions.
No way. What else do you do over there? Is this the only thing?
No. So I spearhead Dr. Laura's pretty much general wellness department.
Okay.
So I not only do EBO2, but I actually do a lot of hormone optimization for both male and female. So hormones, I do a lot of peptides, which I love. It's my favorite thing ever.
We do too.
And then we also do stem cells there too.
Oh,
So,
really? Did not know that.
Yeah. Stem cells are amazing for just regenerative purposes.
Yeah. Someone asked me about that. Where do those come from?
So we actually do autologous stem cells, which means it actually comes from you.
Oh.
So we have this system where we micro-lipo out of our fat cells. So we harvest it out of our fat cells, usually from like the abdominal area, because that's where most people have fat. And we process it down, in the room with the patient. We've got the whole centrifuge there. Obviously all sterile. And we extract like billions and billions of stem cells out of you. And then we infuse it back, either through IV or if a patient has, any sort of joint pain or issues like that, we can do joint injections with the stem cells. We do microneedling with stem cells for aesthetic purposes. We've injected the scalp for hair growth with stem cells. I mean, there's so many things you could do. We've made eye drops with stem cells.
Really?
Yeah. It's endless. Yeah, the possibilities. Yeah.
So this micro lipo, what does that look like?
So it's in office. You're pretty much just taking
local
out
anesthesia.
Yes,
Okay.
yes. Local anesthesia. Yeah. And then you're pretty much, using like a cannula to
But not very
take out.
deep, I wouldn't.
No.
Okay.
Yeah. So it's superficial. It's where your fat is.
Do you get a flatter tummy?
Oh yeah, and
I'm just curious.
That's actually the bonus about it.
Yeah, I was gonna say.
Is that it's kind of like killing two birds with one stone. You actually get an aesthetic result, and it's awesome.
That's awesome.
Yeah,
Look at that.
yeah, and you just gotta lay there.
Yeah. And so how long does that procedure take from start to finish?
That usually a half a day. So the patient comes in around 8 o'clock, and they're usually done by like lunchtime. So, yeah.
Okay.
What are stem cells are like the big rage right now. So like, what's the difference between how you guys do stem cells and when people go to like South America to get stem cells?
I hear Mexico a lot.
Like, yeah, Mexico.
Mexico's huge. Yeah.
Yeah.
So, I mean, Dr. Laura really believes that autologous stem cells is the best kind. The ones coming from you, just because there's no risk of rejection or like a hyperimmune response, which can happen.
Oh, that's scary.
Yeah. So your own is your best. So that's why we do it that way. Yeah.
The body will accept it.
Exactly. Exactly. Yeah. So,
And those are used for healing, right?
yeah, healing people with anything chronic. Really, we see a lot of orthopedic issues. Like I said, joint injections we do. Or even just like, again, autoimmune issues, it helps.
So I would think that people doing both of these procedures would be great.
Oh, yeah.
Right?
Yeah. Yeah. Actually, it's recommended to pair them together.
Really?
Yeah. Mm-hmm. Yep. Yeah.
That's interesting.
It really is.
Yeah.
So that you could have spent a little more time over there.
Yeah. Spend a half a day. Had it all done.
Yeah. I mean, I think it's so incredible how many things are available for this kind of thing to be able to just be your best.
Yeah. The world of longevity is getting to be incredible.
It really is.
Because the whole EBO2 thing plays into longevity too, right?
Oh, yeah.
You're talking about the cardiovascular benefits.
Yeah.
So we talked a lot about energy, a lot about sleep, about the heart. Any other benefits? Oh, we talked about brain performance.
Brain performance. I think those are mainly the benefits. It obviously takes out a lot of lipid peroxide, so it can help lower your cholesterol levels.
I was going to ask, is that an impact on blood chemistry? And I'll be interested because I get my blood done next week, so I'm excited to see that.
Yeah.
Because I had it done right before I saw you guys. And
Perfect. Okay. Yeah, I'd love to know.
Yeah.
Keep me updated. So cholesterol for sure. But that also, I mean, when you're cholesterol lowered, then you have a decreased risk of any sort of cardiovascular issues. So they kind of go hand in hand.
Okay.
But yeah.
So a lot of cardiovascular benefit.
Mm-hmm. Yep. Mm-hmm.
That's awesome.
Yeah. Yeah.
That's my biggest fear. That, getting in middle age and.
Yeah. I mean, especially with the American diet, we are extremely prone to, to just plaque buildup in our arteries, which obviously leads to heart issues. So
yeah, well, I liked the blood pressure coming down because my life is very stressful, and I've seen that it's the first time I've seen it start to come down versus creeping up. Which always made me nervous.
Yeah.
But, so that was a huge positive benefit.
Yeah,
I'll be excited because I've always had like kind of higher than normal cholesterol levels ever since I was 16, and not like crazy high, but I always sit around like 240.
Okay.
Yeah.
So it'll be interesting to see if that comes down a little bit.
Yeah.
But
it should.
Yeah. I'm excited to see that.
But your ratios are all good, I would assume.
Yeah. I still have high HDL, but I've always had higher than they like LDL levels.
I mean, sometimes it's genetic too. Sometimes you just can't control it. But obviously there's things you can do to help. Yeah. With your diet, I mean, eating a lot of fiber helps actually lower cholesterol. Resveratrol helps lower cholesterol. Omega-3s. I think now they're saying red yeast rice helps lower cholesterol. Yeah. So, I mean, I'm a whole full believer of like plants and just food is medicine, really.
Yeah.
You know, you just got to do your research. And I mean, that's how they heal themselves back in the day, you know?
Yeah. Well,
So
this is true.
So yeah, so I'm constantly researching like different like phytochemicals and things like that you can naturally do rather than just taking a pill.
So you mentioned peptides earlier. I want to know what your favorite peptide is currently.
Oh my God, how can I choose?
You got to choose one.
Oh
What's
my
your
gosh.
ultimate top pick?
Right now?
Right now.
Because it always changes.
Right.
In the moment.
Right now, I would say Motzi. Yeah, I love
I'm about to start
Motzi.
that one.
Yeah?
Yeah, I've been doing NAD for several
Okay.
months, and I'm going to take a break off that and
Okay.
try that. Do you like morning or evening doses for that?
Motzi, I like morning because it actually gives me energy.
Oh, it does? Okay.
Yeah, and I actually do it on the days I do strength training because it actually like gives me energy to do it. Yeah.
Great.
So, yeah.
So that's your favorite. Now. He loves that too.
It's my favorite one.
Yeah, it's awesome. Yeah.
You like it more than BPC?
I think it's Dr. Laura's favorite too.
Oh, is it? Oh.
Yeah, he's been hopping up on it before he comes and trains too.
Yeah.
Wow.
Why do you like it?
It's the one that
Because it does so many things. So I just want to
for me, it's energy, but also the cardiovascular benefit.
Yes.
Again, that's another thing that I notice when I take it, when I'm out running around, I just have my cardiovascular system is just more efficient when I'm using it.
That's awesome.
And I like that feeling because I've always had a hard time with the cardiovascular system.
Really?
It's because of my whole life I was a sprinter. So I mean, but like for me to go out and run a mile is torturous. But I'm getting more and more efficient with my cardio. Like I noticed a big thing with the Motzi first, and I noticed another big bump with the EBO2.
Okay.
It was more comfortable doing cardiovascular. I'll give you a perfect story after EBO2. I was walking my dog, and
I love this. I know what you're going to say.
I didn't bring a poop bag because normally it's like not his time to ever do that. And we're like at the farthest point of my neighborhood, and the dog poops in these people's yard.
Oh, no.
And I don't have a poop bag. So I literally like run home about a half mile, drop him off, grab a bag, and my daughter had my car, so I ran all the way back, and I scooped it up, and I'm all done. I'm like, that wasn't very hard.
Yeah. Okay. That's good.
That was the day I was like, oh wow, this is really working.
Oh, cool.
Because normally I would have walked 3/4 of that.
And you're like out of breath.
I got there, and I could even run home. I didn't run home, but I could have.
That's awesome.
Yeah, so
I love that.
I like the ones that I can notice from a cardiovascular standpoint are creating more efficiency and helping me function better that way.
Yeah.
As I get older, I care less and less about like the muscle and all that stuff. It's like more around that.
Yeah.
And because for me, it's all about, can I run around with the kids at football practice for the 2 hours? Can I stay super active? Can I engage with them? So I like that a lot.
Yeah.
That's why I like the Motzi.
Oh.
Yeah.
Yeah, it's a good one. And you can pair that with like pretty much any. Like Motzi is really good when you pair it with the GLP-1.
Oh, really?
Yeah, because what I found is, because, you know, one of the things that Motzi does is it inhibits something called myostatin. And myostatin is the thing that actually blocks muscle from growing. So when it blocks the myostatin, you can actually grow more muscle.
Interesting.
So when you're pairing it with a GLP-1, because GLP-1, you're trying to lose fat, but you know, there's obviously, now we know that you can not only lose fat, but you can lose muscle.
Sure.
So when you pair it with the Motzi, it actually prevents that from happening.
Interesting.
So I love that.
Yeah.
I think like 4 or 5 years ago, I tried one. It's called Follistatin. It's supposed to do the same thing.
Yeah.
Holy shit, it was horrible. You would inject it in your, like for your shoulder, like you couldn't use your arm for 2 days. And it was so, I'm like, this is not worth.
Oof. I wonder what.
I don't know. The doctor gave it to me. He forewarned me. He's like, okay, like you're gonna like no matter where you injected it for like 2 days.
Wow,
it was horrible muscle pain.
You know what other peptide that does that? GHK copper does that.
Yeah, I heard that one.
Didn't to me.
Oh, really?
Oh, really?
No,
you're one of the lucky ones.
Well, because I do it in the glute.
Okay. So you do intramuscular. That may be why.
No. Sub-Q.
Oh,
really?
Oh, sub-Q glute.
But I would also do a warm compress right after. I would get a spicy reaction out of 10 injections, I'd say maybe 2 times.
Oh.
And it was...
Man, every client of mine that does it in the glute, it doesn't hurt when they do it, but like 20 to 30 minutes later, it'll hurt for like the rest of the day.
Yeah.
You're lucky.
For me, it's like a 24-hour like ache.
Really?
Yeah.
Yeah. I heard it's rough.
Yeah.
I don't know. I'm surprised. And I'm a big puss, as you know. So the fact that I was kind of scared actually to try that one.
Yeah.
And then when I did, it was like, oh, okay, that's it.
That's interesting.
Yeah.
Yeah.
That one, NAD actually sometimes gives me a little, there's sometimes that I've done it and I kind of feel lightheaded for a moment.
Mm-hmm.
And then I'm like, oh. Okay.
NAD can give you some side effects.
Yeah.
Yeah. Yeah. Some people will feel like flushed. Some people will feel like a sort of like a palpitations.
I know exactly what you mean.
like
Yeah.
yeah. I mean that happens to me.
Does it?
Yeah.
If it happens, it goes away very quickly.
It does.
Yeah,
Yeah,
like
it
30
subsides.
seconds.
Yeah.
Yeah, it's nothing. I mean, I'm not going to inject and then go run around the block.
Right.
Probably, I don't know.
Your dog poops in the neighbor's yard.
Yeah, I guess so. Why would you ever walk your dog without a poop bag, though? That is a rookie move.
It totally was.
Yeah.
He's like so consistent, and it was at a time like
It doesn't matter.
and it was the one yard that has the sign. You know what I mean? Yeah.
Oh God.
The worst yard you can imagine. That's the one he chose.
Perfectly manicured yard, also.
I ran. I was
funny.
running.
His dog's name is Poseidon.
Yeah. he's
Poseidon. Oh my
Yeah.
gosh, I love that. Maybe he knew. He's like, let's test him. Let's test him out.
100%.
He's like, he got his EBO2 done
Yeah,
today.
let's check that out.
With that dog, it would not surprise me.
Yeah, that's awesome.
So, well, awesome. I
fun.
think we're about out of time. That was perfect.
fun.
Yeah.
This
that
was super
awesome.
fun, guys. Thank you for having me.
Yeah.
You
thank
can
you
come
for
back and
coming
talk
with us.
about something else if you want.
Absolutely. Yeah.
So EBO2, if you're interested in it, Dr. John Laura's office. Do you have their contact info? We can always put it in the notes if you don't.
Yeah, absolutely. Our office is 3333 West Coast Highway,
Yeah.
Newport Beach, California, or you can just give us a call.
And website, drjohnlaura.com?
Yes, drjohnlaura.com.
Okay, drjohnlaura.com.
Yeah.
And he's awesome. I train him 4 days a week, every week.
Yeah.
He's one of my favorite humans. Wicked smart.
Oh my gosh.
It's one of my favorite things about training him is I get to ask a lot
Pick
of
his brain.
questions, pick his
Yeah,
brain.
I bet.
Yeah, he's
Yeah.
phenomenal. So
That's so funny you say that because like when I go work out and I'm with my trainer, I literally tell him, I'm like, there's a reason why I'm paying you. I want my brain shut off because my brain is going 1,000 miles per hour
all the time.
all day.
So don't ask me anything.
Just tell me what to do.
Yeah.
You're counting. I'm
Yeah.
not doing anything. That is so funny that you say that because I'm sure you're like asking him a bunch of questions and he's probably just like, Brad, shut up. I'm kidding.
No. I love it.
no taken.
Yeah. All right.
Here I am thinking he's enjoying these conversations.
Oops.
Awesome. Well, thank you so much for taking the
thank
time
you
to
for
join us.
being here.
Tell us all about you, EBO2.
Love it.
I'm a huge fan of it, so thank you.
Yay.
Yeah.
Awesome. Thanks, guys.
Perfect.
Welcome.